My name is Kevin Kaplan. I'm an orthopedic surgeon at the Jacksonville Orthopedic Institute and head team physician for the Jacksonville Jaguars. Here at the Healthy Center for Living at the YMCA and teaching patients and weekend warriors about shoulder injuries and what things to look for and how we treat shoulder injuries. So it's very important for us to take a step back and look at everything. The shoulder joint is a ball and socket joint. It's the most mobile joint in the body. Okay, it's a huge ball and a small socket, and that's what allows us to have the tremendous range of motion. But because it has such a high or increased range of motion, it's also inherently the most unstable joint in the body. All right? So it's different than a hip joint. The hip joint is a huge socket and a ball. That's a very stable joint. Whereas the shoulder joint is a very flat socket and a big ball. And so it can move in different places and even dislocate in certain situations. So it's a balance between stability and mobility, complex balance between the two. So your body wants to protect itself, so it creates certain things to stabilize the shoulder joint while also allowing you to function. All right, so the first term that we identify that we want to look at as we go deeper into the shoulder is the rotator cuff. All right, there are 4 muscles and tendons that make up the rotator cuff, and those allow you to do all the different ranges of motion, lifting your arm, rotating outward, rotating inward, okay? There's also what's called a bursa sac, or you hear this very commonly. My doctor told me I had bursitis. Well, what the heck, what does that mean, right? So the bursa sac is the fluid-filled sac that's above the rotator cuff between it and the bone. You have bursa sacs all over your body, and they're totally normal, all right, and they protect your body. A bursa sac, if you imagine, if you're doing this over and over again, let's say you have a little bit of weakness of your shoulder and you're doing this over and over again, this bursa sac can get pinched right up here against the bone. And that can cause some inflammation. Any inflammation in the body is termed an itis. All right, so a bursitis is just an inflammation of that bursa sac. All right, so that's also very common in the shoulder. So let's look at the rotator cuff. The supraspinatus, which is probably the most common rotator cuff that is torn. Does anybody have a rotator cuff tear in here? All right, there you go. You guys come on up. I mean, you know, you could tell us, right? So supraspinatus starts in the shoulder blade. All right, it's like a rubber. You got to think of tendons and muscles like rubber bands. So they start from one point and they attach to another point and they tension, they pull. So when your brain fires a signal to this muscle and the nerve comes down from the spinal cord and it hits right in this muscle, when that electrical impulse hits, it tells that muscle to fire and that muscle will then shorten. So if this shortens, this will go up. This is your arm. So as that muscle shortens, it raises your arm. Okay, that's what the supraspinatus does. The infraspinatus is in the back, okay? So it starts in the shoulder blade in the back and comes and it wraps around the shoulder around here. So same concept. So if this muscle was to shorten, then the ball would roll outwards like that. So that's an external rotator, okay, which is the infraspinatus. And there's a second one called the teres minor, a little bit smaller, but does the same thing. Point A, point B, when the muscle fires, that will shorten and the arm will externally rotate. And then finally, the subscapularis, which is the rotator cuff in the front. Starts in the front of the shoulder blade, attaches in the front of the shoulder. So now, if this shortens, what happens? It goes internal. So that's the internal rotator. So you got this motion, and this motion. Those are the rotator cuff. That's what the rotator cuff does basically. So you can look online for information at www.joi.net or my website, kevinkaplanmd.com. There's a lot of information about shoulder injuries and different things that you can do to treat shoulder pain prior to seeking medical attention. But if you have pain in your shoulder that doesn't get better, pain that's waking you up at night, pain when you're lifting your arm over your head, clicking and popping, get some help and come in and see us at JOI and we'd be happy to treat your symptoms.